Hi classmates, Eva Bain here. I'm going to show you a quick template how to do the continuity assignment. I'm also going to post this template for you guys on Facebook so you can utilize it if you'd like to. I'm going to screen share so I can show you from the template itself so you won't see my beautiful face. So here it is. The continuity assignment is basically two SOAP notes, two sets of 3 SOAP notes. So, and then a Prezi that is also 3 SOAP notes. And I can show you guys my Prezi later if you want. I don't know if that's a honor violation, so maybe I won't, but this is, again, this is the basic template. You have your first client, you give your basic demographics, her age, her gender, her D's and P's, ethnicity, and language. And then you do 3 SOAP notes. So 1 visit, 2 visit, 3 visit. You can add a 4th if you have a 4th as well. In the visits, you basically write a SOAP note. And then you write another SOAP note. The SOAP notes vary based on the type of visit. As always, you can have, I think, any types of visits as long as they're, calculatable per like our TIFON requirements. So I'm going to show you what I did. Again, just a template for basic SOAPs for 1 patient, for example. So here we have the date. We have our chief complaint. It's a routine prenatal visit. She's 37 and 5. Here we have, how she's feeling, any kind of chief complaint, any kind of review of systems. You can do a history review as well if you'd like. I included the translator number because the reflection is an important part of the continuity assignment. And obviously, it's more challenging to provide care to patients who speak a different language than you do, as I do every single day. So just her subjective information, the translator number that we use, we always put there so we can have some kind of permanence or some kind of documentation of who the translator was. An objective for a basic prenatal, I would definitely include blood pressure, weight gain, fetal heart rate, fundal height presentation, any recent labs or sonos, and then a basic assessment. So, 32-year-old female, G3P2, uncomplicated prenatal course, say she has anemia. And then your plan is, are you sending her for meds? Are you prescribing her any medications? Are you sending her for any referral, screening, diagnostic tools? Are you educating her on preterm labor or preeclamptic precautions? And what kind of follow-up? So follow-up 2 weeks or 5 weeks or whatever your guidelines are. Visit 2 for me was an admission to labor and delivery. I did not end up delivering this patient. So the date, the chief complaint, why she's there, subjective information, the basic triage assessment. So is she contracting? Is she leaking fluid? Is she bleeding? Is baby moving well? And what kind of pain she's in? And you can include, again, a basic medical OB history as, you think necessary, and allergies and meds. An objective, I kind of added on to the prenatal visit objective information. So you definitely do a blood pressure, a full set of vitals probably is indicated here. I deleted all my data. So I'm assuming that I had, again, like a full, SpO2 and heart rate and all that, temperature for an admission. Her weight, her overall weight gain, her BMI, all that stuff. Fetal heart tracing, contractions, fundal height. We don't usually do in labor and delivery, but you can include it. Again, include information as you see fit. Presentation obviously is important. EFW, we do vaginal exams, things like that. And then any recent labs, is she GBS negative or positive? What's her H&H look like? What's her blood type? And then your assessment, the basic assessment is always, you can say late in labor, category 1, GBS positive, GBS negative, any other assessment. And then for your plan, so are you admitting her? Are you sending her home? Are you ambulating her? Are you doing vitals on her? Whatever your plan is, that's what you're going to write there. And then for visit 3, I have a postpartum visit. So routine postpartum visit, status post, NSVD 39 and 4 delivery, say first degree laceration, female infant, Apgar's 9-9. I would say it's subjective that she's resting comfortably. Her pain is controlled with her medication. She's been voiding, but she has not had a bowel movement. She's breast and bottle feeding, and she thinks it's going well. And she plans to use condoms as contraception. Say your objective exam would be focused for postpartum, I think. So a breast exam, a uterine exam, lochia, perineal, and extremity exam. And did you do any labs on admission? Do you have postpartum labs already in? You can include those as well. Your assessment is, how about her postpartum course, prenatal course, if you'd like any other assessments. And then your plan, are you sending her for more labs? What kind of education are you providing, and any prescriptions that you're writing? Patient number 2 is the same as patient above for me. So it would be, again, demographics, visit 1, visit 2, visit 3. And then for patient number 3, I just said, see my presentation. And I inserted the URL for that. I then did my reflection. It was simple. I did not have any parenthetical references in my reflection, and just a personal reflection on culture and continuity of care. And then for my final page, I have my reference list. I included the reference that they provided as required reading. I thought that would be appropriate. I also included a reference something that I read about continuity of care, but neither of these references I had used in my actual assignment. So that is all. I wish you all luck in completing this assignment. To me, the most challenging part is probably getting the patients, especially if you're in a clinic where, there's a lot of clinicians and whatnot. So that for me was the most challenging, as well as probably creating the Prezi.